Hello, my name is Rob Cowie from the Oregon Health Authority. Welcome to this afternoon's CCO 2.0 Provider Webinar. I'm joined today by Lori Coiner, our State Medicaid Director, and David Baden, our Chief Financial Officer. And we're here to give you an update on the transition to CCO 2.0, what it means for healthcare providers, community partners, and the 1 million OHP members you serve. And we want to thank you for the vital role you play in the lives of OHP members and in health transformation in our state. So let's take a quick look at today's agenda. So we're going to provide an update on member transition and recent changes in several counties and what they mean for OHP members and what they mean for the providers who serve them. We'll talk about the member and provider communications that the Oregon Health Authority will be sending in the next several weeks to inform members about the changes in different counties and what it means for members. We'll talk about continuity of care. What are the measures that the Health Authority and CCOs have put in place to prevent disruptions in care for members as we move to new contracts that take effect on January 1st. We'll go over ways that providers should be working with CCOs and what that means in terms of contracting, billing, and payment. We'll talk about the opportunities for members to change plans now that the November choice period has concluded, and give you some information on resources and ways to keep the members you serve informed about this transition to CCO 2.0. At the end of the presentation, we will have some time to answer your questions. We want to thank everyone who has submitted questions. We've got a large number of questions, and we'll also have an opportunity for people who haven't yet submitted. If you have a question, you can submit it through the question box on the webinar tool. And at the end of the webinar, you'll receive a link to a survey, and we'd really appreciate your feedback on this presentation so that we can continue to keep you informed and ensure that you're getting the right information you need as we go forward with CCO 2.0. So without further ado, I'm going to turn it over to Lori Coiner.
Good afternoon, everyone. We're going to start by talking about member transition, and I'm going to give the audience a high-level overview of the original goals of CCO 2.0. So the goals of CCO 2.0 are guided by Governor Brown's priorities. And in October of 2018, the Oregon Health Policy Board approved a comprehensive set of policies that include 4 main focus areas. One is to improve access to mental health services. The second is reward providers for improving health outcomes through value-based payment. Address issues outside of the doctor's office that impact health and then also reduce costs. This collective focus has been coined CCO 2.0. It really builds on the gains of the first 6 years of CCOs and continues to tackle our biggest health problems. We've developed a rigorous new contract that has provisions that gives OHA new tools to ensure CCOs integrate behavioral and physical health, target investments in social determinants and health equity, and used evidence-based and efficient care and remain financially solvent. In addition to these CCO 2.0 policy priorities, we've had a real focus in moving to the new contracts on member transition and member with a focus on members. And so the priorities here have been minimal disruption to members' care. We're trying to keep members with their providers as much as possible. Another area that we've used as a guiding principle is to seek improvements based on best practices, evidence, and inputs from stakeholders and communities. And then finally, honor member choice. We are going to continue to honor member choice, though, as we'll walk through in some slides later on, that we've had to make some changes just because of changes in the market. But our overall goal is seamless transition for members so that they are able to continue their high quality care with their provider.
All right, next slide is to me. Again, this is Dave Baden. I'm the Chief Financial Officer here at the Oregon Health Authority, and thanks Rob and Lori for setting the good context for the call to get today, and thanks everyone for the work that you do for the Oregon Health Plan and our members. So just wanted to go back as a reminder of where we are in the market and the changes, at least contractually, for 2020 around CCOs, as well as just speak briefly about some decisions that were made back in July around a few of the CCOs, awarding them a 1-year contract to start the process. So we have 15 CCOs now in CCO 1.0, and we will have 15 CCOs as we move to CCO 2.0. But there is some changes between where some coverage areas, as well as where there are some new CCOs and some CCO closures. So just quickly to go through the items in this slide. So Pacific Source is growing in a couple of service areas. Now will be an offered CCO in Lane County and in Marion Polk County. The initial discussion around Trillium and Multnomah, Clackamas, and Washington County, and we'll talk a little bit about changes around that here in a couple of slides. There also were a couple of CCO closures. Primary Health, which has members in Josephine, Jackson, and parts of Douglas County, as well as Willamette Valley Community Health, which serviced Marion Polk and parts of Lynn, Benton, Yamhill, and Clackamas County. Again, in those areas, in the primary health service areas, will be All Care, Jackson Care Connect, and in Douglas County, a little bit of Umpqua Health to cover those areas. And in Willamette Valley, for the most part, is being covered by Pacific Source as they come into Marion and Polk. And just the last piece on this, there are 4 CCOs who, in the process of review of their application, OHA had some concerns about their readiness to meet all of the policy goals laid out in CCO 2.0 that Lori had talked about. But in many cases, to these 4 CCOs, they were the only CCO in the area. And we had concerns about our member-focused continuity of care if we would end those contracts now. So we decided to give them an opportunity to show us that they do have appropriate policies, procedures, and plans in place by awarding them a 1-year contract. And we've been working with them very closely over the last few months to show us through what we're calling a remediation plan, to show us that they are indeed ready. We actually feel like all 4 are making some very good progress in showing us that they are ready, but we're going to make some final decisions next month about whether to extend those 1-year contracts into 5-year contracts. So just also, for those that potentially were on the prior provider webinar, but just other things that you may have seen in the news and other things that are out there that have happened more recently. So when we made our first look at assigning members where there are choice areas to different CCOs as there are these changes in the market, it was based on an August version of the providers that CCOs had under contract. Well, we knew at that point that things were subject to change, and things did change, and so we felt that we needed to make some changes based on our concern of linking as many members as possible to providers that are going to be under contract starting in January. So that's really the purpose of why we're doing what we're doing. And so again, as it states on the slide, due to those changes, we have reassigned some members to a different CCO other than their original match to keep them with their current providers. And just as a reminder to what originally we had done, we had put together an algorithm that looked at a member's claim history over the last 24 months and tried to link them to their primary care and behavioral health providers as closely as we could. Well, with provider contracts changing, we needed to change that. And so the 2 areas that are most impacted with those changes are in the TriCounty area. So I think, as probably many of you saw, based on OHA concerns with Trillium not having a hospital under contract in the Tri-County area, we are not going to assign any members to Trillium as we get started with CCO 2.0 in January. So any member who matched or in this first member choice period chose Trillium are going to be reassigned back to HealthShare. This should really be no differences in for current members, what they have now. They will remain with Health Share and should have access to the providers that they have access to today. In Lane County, there was a change related to Trillium contracts with Peace Health and a couple of other provider groups that also meant that we did do a reallocation of many Trillium members over to Pacific Source Lane, again, to best match members to providers that are under contract. And we'll talk a little bit about the letters that people will be getting to inform them of those change. Last but not least was one that we had not occurred as of in August, but did occur between August and today, is in Jackson County, where there's a change in a very large IPA in Jackson County who no longer is going to contract for primary care with All Care. And so as a result, we ran All Care members through our algorithm to assure that we are being member focused and trying to link members to contracted providers, which then as a result means some All Care members will get a letter that will say that they've been reassigned to Jackson Care Connect.
Okay, so let's talk now about what the Oregon Health Authority is doing to make sure that members stay up to date about these changes. And one thing I do want to say is, so Dave just went through a lot of changes that are happening in the marketplace, a lot of information to hit you with. One, you will get a PDF version of these slides after this webinar, so you'll have these slides to refer to. In addition, I really want to encourage all of you to go to our website where we have information for both members and for providers to stay up to date. And as I'm sharing with you some of the communications that have gone out and will be going out, you can go to that site to see the information that members will be receiving so that you're able to anticipate their questions and be prepared to answer them. And we'll have a slide at the end with all the various resources that you can refer to get information and stay up to date. So let's talk about letters that went out earlier this month to members of Willamette Valley Community Health and Primary Health, two of the CCOs that are exiting the market at the end of this year. So we did send a communication to members served by those CCOs currently to let them know who their new CCOs will be after January 1st, reminding them that their current CCO remains their CCO until the end of this year, telling them how they can access and contact their new CCO, and most importantly, what are the steps that the health authorities put in place to ensure that members can continue to see their providers after that transition to a new CCO, and we'll be talking about those steps a little bit later in this presentation. So that's the information that's gone out to members served by closing CCOs. Now, let's talk about information that members are receiving who are in counties that are affected by some of these CCO and provider contracting issues. In mid-December, members in the TriCounty area will be receiving information from OHA about changes in their choices. So members who either have chosen Trillium or were matched to Trillium will receive a letter letting them know that Trillium is not an option to enroll members at this time, and that they will remain with HealthShare as their CCO. In addition, members who chose HealthShare or were matched with HealthShare will also receive a communication letting them know that Trillium will not be available to serve members until they have a hospital. And so, again, this is to ensure that there's not confusion on the part of members who may have received information earlier in the fall about a choice period starting in January. We want to make sure that members understand that for the Tri-County region, HealthShare is the only current CCO option. So they will receive information that will clarify that. In Jackson County, all care members who have been affected by provider contracting issues will be notified that they are moving to Jackson Care Connect. However, they will be informed that if they want to make a choice to go back to All Care after January 1st, they do have that option between January 1st and March 31st. In Lane County, similarly to the TriCounty area, Trillium members who have been served by Peace Health or the Oregon Medical Group will be notified that they are no longer going to be served by Trillium and that they are moving to Pacific Source Community Solutions, Lane County. They'll receive information about the steps that we've taken to ensure transition of care, and in addition, they will continue. They will if they prefer to stay with Trillium, they will have that option, and they can exercise choice between January 1st and March 31st. And then other members of Pacific Source who've chosen or been matched to Pacific Source will receive information about the contracting issues affecting Trillium and how that may affect any potential choices they may have between January and March. And then last but not least, for members living in Polk and Douglas County who are affected by the Willamette Valley Community Health or the primary health closures, who also have choices in their counties, they will get information about transition of care information to ensure that they understand the steps that are in place to maintain their continuity of care as they transition to a new CCO, but also reminding them that they have the opportunity to change plans between January and March. And now Lori is going to talk a little bit about our guidance to providers about talking to members about their choices.
So we have seen some providers who've developed communications for their patients, and we do have provisions in the contract between OHA and CCOs, and CCOs contractors or providers around materials that would be deemed marketing. And so I want to walk through what we consider marketing and what materials would need to be reviewed by OHA and those that are informational and don't require review. So if a member is not in the CCO that you participate with, do not use wording that urges or directly asks the members to change that CCO. That would be considered marketing materials. So an example would be in your waiting room, you have a sign that says choose CCO Y so you can get your care with provider X. That would be urging or asking the member to change. Any printed materials, including website material with such wording, must be submitted by the CCO to OHA for review and feedback. You can give informational wording that would be, an example is provider X is contracted with CCO Y. So that's stating a fact for the member to know, and but does not urge them to change their CCO. Additionally, if you're using an OHA material or the Pick Your Plan images that have gone out, those Pick Your Plan has images and logos that are on the letters that members have received in the fall. Just make clear that those documents that you produce that use those logos are not produced by OHA. We're going to move to talking about continuity of care, and included in that conversation we'll talk about various timelines so that you'll know when your patients are receiving material, requirements that we have for CCOs around continuity, and communicating with CCOs on member assignments and what you as providers should do. As I mentioned earlier, we really have focused this transition time as much as possible on the member, and so and member continuity of care. So we do have provisions in the CCO contract that address prior authorizations, maintaining physical health providers and behavioral health providers as well. So prior authorizations will be honored for up to 6 months for physical, oral, and behavioral health and prescriptions. Members will be able to see their existing providers regardless of service area or network for up to 90 days for primary care and for up to 180 days for behavioral health providers. OHA will transfer claims and fee-for-service data between CCOs so that CCOs have information on the members that they are receiving, such as prior authorizations. So some additional contract requirements that start with the January 1st transition, or that prepare for the January 1st transition, are highlighted in this slide. By December 20th, the CCOs need to contact members who have current needs, such as those that have pre-approved services like a prior authorization, and those members that are receiving behavioral health services, to ensure continuity of care. By January 5th, CCOs need to have assigned a primary care provider for each of their members. By January 14th, all members should have received a welcome packet from the CCO and their member ID cards and a provider directory that's current for the members. And then by January 20th, there should be completed contracts with the members' existing providers to ensure continuity of care. They may be point of service agreements, but some sort of contract that ensures that the member can have continuity of care, and a complete plan to transition all members need to be completed by January 20th as well. This is some information, just background for you to know when the CCOs will be receiving their member lists. So OHA will send the CCOs their final lists of their 2020 allocated members at these times. So on December 7th, lists for those members in Benton, Clackamas, Douglas, Jackson, Lane, Lynn, Multnomah, Polk, Washington, and Yamhill counties will go out. And then on December 14th, the lists for Josephine, Polk, and Marion counties. One thing that we've had some requests by providers around OHA giving them their member list directly. We cannot provide lists of members directly to providers, so please contact your CCO to learn about the patients that you will serve, and they will have that information, by the middle of December. So what can providers do to support OHA members during this transition? We really want you to assure your patients that care will continue and that their benefits will stay the same. Even if they change CCOs, they should have the same benefits. They should keep their appointments and continue to fill their prescriptions, and plan to see their provider. And if they move CCOs, that there is a transition period that they can move from their current provider to new providers. We also encourage providers to contract with their members' new CCO or complete single case agreements with the CCOs during this transition period. As I stated earlier, members can see their provider regardless of which CCO they're contracted with for the first 90 days if it's a physical health provider, and the first 6 months for behavioral health providers. The other thing is to be sure to bill the CCO. Providers cannot bill members directly for services covered by Medicaid. And so there's a prohibition for that, and we will talk a little bit later here about what to do if you're having a difficult time engaging with the CCO around payment. And to that end, we'll be talking about the contracting and then the billing and payments when you're working with CCOs. So the first thing would be consider joining the CCO's network if you have a patient or patients in a CCO that you aren't currently contracted with, or complete a single case agreement so that that member has some continuity of care and can transition to a new provider. Contact the CCO to learn about the systems, policies, and procedures that you'll need to follow to get these services approved and how to bill the CCO successfully during this transition period. If you're not satisfied with the CCO's decision about either your participation with that CCO or covered services, we do have a CCO appeal process that you should follow first. So contact the CCO first, and then if you are denied that, then request OHA review. We do have an appeal review process within OHA Medicaid if you need resolution beyond that. Again, payment is a matter between the CCO and provider. Medicaid patients don't have co-payments, nor are they expected to pay. CCOs must pay or deny services in a way that 90% of all valid claims must be paid within 30 days. We expect the CCOs to either pay or deny 99% of their claims within 90 days of receipt. And again, if you have a dispute around a payment, follow the CCO's appeal process, and then if that is still in dispute, we have a form, OHP 3085. You can call Provider Services and obtain that form and then take the appeal to the OHA directly. And just a few other details around payment during this transition of care time. The expectation is that the CCO shall reimburse non-participating providers. So, for example, if you're on a single case agreement at no less than OHA's fee-for-service rates, those are published on our website. And then during the transition, CCOs must approve claims for covered services, even if they have no documented prior authorization. You can negotiate with the CCO for a higher rate, and if you cannot agree on a rate, then you can submit a claim using the OHP 3258 form. There's an example of forms of that form on this slide. Next, we'll talk about how members can change plans. We do have another open enrollment period that goes from January 1st through March 31st. And then it will also be options for members to use our regular OHP process for changing CCOs as well. So members were asked to pick a plan if they had a choice within the CCO region. That initial member choice period closed on November 17th. There are no changes that will occur between that time and January 1st, so that OHA has time to solidify the member files and get them to the CCOs by the middle of December. If a member wants to change CCOs, they can and have an issue that they want taken care of right away. The phone number is here on this slide. And when the choice period occurs from January 1st through March 31st, members can use the web tool, which the link is on this slide. They will not need a letter ID during this time period to change plans. There was a letter ID that came with the letters that they received in the fall. They will need their OHP number. We do have the choice areas listed on this slide. I'm not going to walk through all of them, but you can see which areas have where members have choice, and I'll use the green box on the left just to give an example. So for the zip codes in Douglas County that are listed there, those members can choose between All Care and Umpqua Health Alliance. They can go to the website in the first 3 months of the year and switch plans, or call the phone number that's listed here, and if they so choose. And that applies for all of the colored boxes in this slide. Now, if there isn't a choice area, members will still have an opportunity during 2020 to change their CCO. So they can choose in other times where they, when they enroll or have their initial enrollment, they'll be able to switch plans within the first 30 days after initial enrollment. Sometimes, if there's an error, they also have 3 months after initial enrollment to switch plans for any reason if there's more than one CCO in a region. After being enrolled at least 6 months, they can choose one time during the year they can switch their CCO, and any time that they do their renewal. So these processes will occur in some areas where members stayed with their current CCO, but there's more than one choice. They will have opportunities during enrollment, renewal, or after, one time a year that they can change. They will have to call the regular OHP client services number, which is listed here, or submit the request on the ONE system. The web tool is only for those members where there's a pick your plan area. So this last set of slides here is going to give some information to you for further resources, and we're going to talk a little bit about Medicare, Medicaid, or dual members. For dual members, They were not part of the pick your plan choice period, no matter where they are in the state. They have been maintained in their current CCO because they are considered a special population, and we wanted to ensure continuity of care. So the Medicare enrollment doesn't change at all during this time period. If they do choose to change their Medicaid plan during the first part of 2020, their Medicare plan is going to stay the same, or their Medicare Advantage. If they choose any Medicare plan, they can choose any Medicare plan they want, and they can choose to be in fee-for-service Medicare. They also can choose to be in fee-for-service Medicaid, though that's an opt-in option now. And if you have a member that's a dual or a Medicare Medicaid member, and they want to change their CCO, have them contact their local AAA or APD office, and they will explain the options that work best for them and how to do that. So how to stay informed. Rob mentioned the OHP provider website and the CCO 2.0 website. Those two will give you information around specific to providers, as well as the materials that the members have received and other updates on CCO 2.0. We have a Provider Matters newsletter. We've been putting CCO 2.0 updates in that newsletter. If you aren't receiving it, you can go to the provider website and ask. And then we have Facebook and Twitter feeds here that you can also access.
And again, you'll receive a PDF of these slides with links that you can click on to go to these sites or sign up for these either these newsletters or go to our social media platforms. So that concludes the presentation. So what we're going to do now is answer some questions that came in prior to the webinar, and also some questions that you submitted. The first question is one that came in during the webinar and asks, why are members receiving notice of reallocation 2 weeks before January 1st if they can move back to their CCO January 1st? Why not wait to inform them until January 1st? And the answer to that question is because, again, as we've talked about a number of times in this presentation and in previous webinars, our top priority is to make sure that member transition is as seamless as possible. So we want to make sure that members are aware of what's happening, both in terms of their allocation, their choices, and in the case of members who are served by CCOs that are having reallocation, that they're aware of the changes that are happening. We've heard questions about why are you not informing members sooner than mid-December? We are moving as quickly as we can to stay up to date with changes in the process. Unfortunately, we are communicating with well over 400,000 members in this process, and so we are moving as quickly as we can to develop information, have it translated into all the different languages that OHP members speak, and then make sure those letters get printed and sent to the right homes. So we are communicating as quickly as we can with members and doing this webinar so that you're prepared and you know what's happening, what's coming down the pike, and that you can help your members with that transition as well. Let's see, another question about reallocation and choice. If Trillium in the TriCounty area gets members, what would be the earliest date that they can enroll members?
So thanks, Rob. This is Dave Baden again. So as we have reported out in the Tri-County, we, because of concerns of Trillium not having contracted hospital to assure that the network is adequate, we're not allocating them members to start. So what we have informed Trillium is, as they continue to try to contract a hospital and potentially more provider groups, that if that would happen, that we would start allocating new members to them. The earliest that would happen would be in April, but again, it depends on a contract process between Trillium and hospital and provider groups.
Another question that came in during the webinar: for patients already switched from primary health to all care, should we keep appointments and bill all care as instructed?
The answer, this is Lori Quainer again, and the answer to that is yes. You can keep appointments for physical health appointments for the first 90 days, whether or not you're contracted with all care.
Regarding the 90-day physical health transition, does this apply to specialists if a patient is in the middle of treatment and changes CCOs, but the provider does not have a contract with the new CCO?
This is Lori again. Yes, the physical health transition does apply to specialists. Again, we encourage you to contact that CCO and obtain a single case agreement so that you can ensure that you're going to be paid. But the CCOs are obligated to cover services for their members, even out of network, for the first 90 days of treatment for any physical health services and the first 180 days of treatment for any behavioral health services, which would include substance use disorder treatments as well as mental health.
A question regarding duals. If duals move, are the transition of care timelines honored?
Again, yes. The duals or any special population, such as foster children, would fall under the same transition of care provisions and require a 90-day transition period for physical health and 180 days for behavioral health.
Here's a question that came in prior to the webinar about credentialing and contracting. How quickly will providers be credentialed and contracted with new CCOs?
So I could probably take that one. So all new CCOs must establish subcontracts with required providers by December 1st of 2019, so just over a month from now. And in order to be ready, all participating providers must be enrolled with Oregon Medicaid by December 15th, 2019. For specific CCO timeframes on their contracting process, please contact the CCO for any other specificity on contracting and credentialing with them.
So a question about reallocations. The question reads, we're specialists that contract with both Trillium and Pacific Source. Is reassignment based on primary health only or on specialty care?
So I could probably take that one. So the member algorithm that we have been using through this whole process is based on primary health and behavioral health, sort of a set of core billing codes that link to visit with a primary care physician or visit with a behavioral health physician. It does not look at specialty care in the algorithm. So if in this specific question, if there is a contracted with both Trillium and Pacific Source, it shouldn't be an issue, obviously, with that patient. Wherever they are assigned to, they would still obviously be able to retain services. If it's one or the other and there is a switch, this is where the continuity of care guidelines would come into place that Lori had talked about. But again, to go back to the algorithm and why we based it on primary health and behavioral health is, again, we were focusing on trying to keep those those relationships intact, but also keeping the process simple enough to not create potentially alternate scenarios if we went too far down in different types of specialty care or dental care, etc. Does that mean potentially that the algorithm did not perfectly assign someone who has only seen a specialty care provider potentially in the last 2 years? Yes, I think there is a potential that someone was moved into a CCO where there will be not a continued contract. That is why we have the January through March choice period being that long to allow for transitions and for members to pick the CCO that best fits their health needs. If that means that they switch because of that, they have that option to switch during the time period where continuity of care guidelines are in place. So we recognize that there are going to be patients that are going to show up when you are contracted with one and not the other in Lane County and potentially in Jackson County, where there are concerns. Please adhere to the continuity of care guidelines and give factual information about who you're contracted with. And we've given you some guidance on where they can go to change their plan if they feel that they need to do so.
Here's a question from a provider that serves Willamette Valley Community Health patients. Do we need to apply for credentialing with Pacific Source?
Yes, you will need to apply for long-term contracting and credentialing with Pacific Source, as Willamette Valley will no longer be serving clients starting January 1st.
Another question about credentialing. Will patients be able to see providers going through credentialing during the 180-day period?
Yes, the transition of care and care continuity provisions still apply, so you will still be able to bill the CCO for the member during that initial 90-day period for physical health providers and 180 days for behavioral health. There was another question around that's similar from a provider in Willamette Valley asking if PAs that are approved by Willamette Valley, would they be honored by Pacific Source? And the answer is yes. At least for prior authorizations for both physical services and prescriptions, Pacific Source will honor those for the first 180 days or 6 months.
Okay, we received a question about tribal members. Are Native Americans, Alaska Native members required to enroll in a CCO?
No. Native Americans and Alaska Natives are, by federal law, are given the choice to be in fee-for-service or within a CCO. And initially, at least starting January 1st, we are not changing the enrollment for Alaska Natives and Native Americans in terms of if they're in fee-for-service, they're staying in fee-for-service, and they will make that choice at re-enrollment if they want to switch. If they are in a CCO that's in a choice period, they're allowed to make a change just like other members.
Some questions about billing. What if the CCO does not pay, even if we have all the appropriate documentation?
The first step, and we outlined this in a couple of the slides, and that you will be receiving a hard copy or a PDF after this webinar. But the first thing to do is file an appeal with the CCO, and if that is denied, then file an appeal directly with OHA. Just a reminder, do not bill the member.
We've heard there's a 120-day timely filing limit for CCOs. Is that true?
So that question, neither Dave nor I have the answer to, and so we will have to determine that, and we will include it in as part of the FAQs that will go on the provider site.
Where do we get information about working with new Pacific Source Community Solutions and Marion Polk and other CCO provider numbers and contacts?
So I could take that one. So, all CCOs have received some guidance from OHA about providing information for providers, potential providers in their communities, especially the new places going forward. So I think my encouragement to providers that are interested in working with a new CCO that's coming into to that area is to go to their website, and I think all of them have contact information to talk about credentialing or contracting with that CCO. So there is on OHA's website on the as Rob had talked about in the provider website, there is information and contact information about each CCO if you want to go one stop to get that rather than shopping in each CCO's spot. But each CCO does have their own contact information about what would need to be done to contract and credential with them.
We received a question about some of the member choice information on the website. When will the CCO comparison guides be updated? Trillium is not up to date for Lane County. They're not contracted with Peace Health. So just want to make sure that everyone is aware we have updated information on the member choice page as of November 13th in English and Spanish. And we are working to translate that information in other languages, and that will be posted to the website as soon as possible. What's the timeline for disenrollment of members during the January through March period? And how quickly will they be disenrolled and enrolled in their new CCO?
So I'll start, and Lori can probably jump in. So again, right now, for those members that we talked about in the allocation process, those members that we have matched with one CCO or the other, that's how they will start on January 1st into that CCO. So they will be enrolled in the CCO that they have been matched with as they start January 1st. Now, if they take advantage of their opportunities in the open choice period from January to March to make that change, how quickly they would then be able to switch from one to the other. Let us add that to the FAQ just to make sure that we're giving the most accurate information. If it's the next month, would probably likely be what I think the answer is that if they switched, let's say on January 15th, I think it would be starting February 1st is that when they would be in that new CCO, but let us double check to make sure that that's correct.
What provider portal will be used for prior authorizations?
This is Lori. Again, we'll have to provide information. There is, we have engaged with the CCOs on transitions of care and providing the prior authorizations between CCOs. We will have to get back to you on the specific portal.
I think one last question. What if we have patients who use a number of Peace Health specialists and are assigned to Trillium?
I can take that one. Trillium must provide the continued access to care for 90 days after January 1st, just as we've discussed and some other questions. And then those Trillium members who want to change to Pacific Source will be able to ask for that change from January 1st through March 31st. So, for example, if a member wants to switch, they can go to the website. You can continue to see them through our continuity of requirements, and then their until their membership actually switches, and then you'd be billing under contract.
Okay. So I want to thank Lori Coiner, our State Medicaid Director, and Dave Baden, our OHA Chief Financial Officer, for joining us today, providing this information, answering your questions. Most importantly, I want to thank you in the audience for joining today and the work that you're doing to care for OHP members. Hope this information is useful to you. Please check out the resources on our website and sign up for Provider Matters and stay informed through our other channels as we go through this transition. Really appreciate your partnership in making this transition as smooth as possible. After this webinar concludes, again, you will get the slides and a link to a brief survey, and we really appreciate your feedback so we can continue to keep you informed as well as we can. So with that, Rob Cowie, Communications Director here at OHA, and thank you for joining.